Hello and welcome. Sorry for the long delay due to some family issues. Anyway, it doesn't matter. From today, I'm going to take some new approaches. Today's topic is our formation of palate, which is also known as palatogenesis. This formation or the development occurs in the intrauterine period or intrauterine life of the baby from 5th week to the 12th week. Okay, so this formation occurs from the two segments. One is our frontonasal process, another is intramaxillary segment. Okay, now this frontonasal process and intramaxillary segment both merges together and forms primary palate, which is also known as median palatine process. Within few days it forms premaxillary part of the palate, which is the almost 3/4 part. In the 6th week, two mesenchymal projections extends from the maxillary process, which is also known as secondary palate or lateral palatine process, which is almost 1/4 part in area. Now in 7th to 8th week, what happens? Primary palate and the secondary palate in all direction merges together or combines together in the midline, in the nasal septum, in the posterior part, even in the basal part of maxilla. Now right side and left side primary palate fuses with together and form hard palate, and in the right side left side secondary palate fuses together form soft palate. Now anterior and posterior both palate merges together and forms definitive or the ultimate palate, which occurs in the 11th to 12th week. And few extra knowledge point like this: from the first pharyngeal arch you are getting tensor belli palatini with this muscle which is associated with the palate, and from 4th pharyngeal arch you are getting the levator belli palatini, palatoglossus, palatopharyngeus and uvuli. Okay, this is the overall development of the palate. I hope you understand. Now the next topic is our formation of the nose or the development of the nose. See, in my earlier videos of the face development, I told you that the little bit introductory point of the nose development. Now after formation of the foundation of the nose, what happens? It gradually forms a nasal sac. Now this nasal sac enlarges dorsally and caudally. Dorsally means backward and caudally means downward. Okay, now during enlargement it separates from the stomotium and forms a thin membrane which is known as bucconasal membrane. Bucconasal membrane, within few days it ruptures and forms posterior nasal aperture, which is also known as choana. Now try to remember my earlier videos and today's video. Combinedly you have to understand that from the frontonasal process we are already getting the nasal septum and bridge of the nose. Okay, from the medial nasal process I told you in my earlier videos, from that we are getting the dorsum and the tip of the nose. From the lateral nasal process, which also I talked about in my earlier videos, you are getting the lateral wall of the nose and the ala of the nose, elevated margin or the elevated masses, which ultimately forms the concha, and within few weeks gradually olfactory epithelium forms and associated paranasal sinuses are actually formed from the or developed from the ectoderm. So this is the overall development of the nose. So see you in my next video. Till then, bye.